At this meeting, I presented the results of KEYNOTE 199 cohorts 4 and 5. KEYNOTE 199 is a multi-cohort study. The first 3 cohorts were with pembrolizumab alone in patients who had already received chemotherapy, and they were reported at a different meeting. At this meeting, I'm presenting cohorts 4 and 5. Those are patients who have metastatic castration-resistant prostate cancer progressing on enzalutamide or Xtandi. And those patients continued on their enzalutamide and received pembrolizumab. So we were looking at the benefit of adding the two in a larger study than previous studies. And we found that for cohort 4, which was patients with measurable disease, there was a 12% confirmed radiographic response rate. However, there was about 24% unconfirmed. If you took them all together, confirmed and unconfirmed, it was a quarter of patients. And then the radiographic progression-free survival was about 4.2 to 4.4 months. We found also that as a whole, there was a 14% PSA response rate, which is a PSA decline of 50% or greater. And we saw also in this study that the responses, mostly in terms of the radiographic responses, were durable even after discontinuation of pembrolizumab. So it was confirmation that this combination has an effect on prostate cancer. The important adverse events included skin rash, which is known to be a complication of this combination. We saw it in about 25% of patients. Most of the time it was controllable with just steroid ointment on the skin or oral steroids, but one patient did require IV steroids. Otherwise, there were the expected immune adverse events, but they didn't seem out of line with what we normally see with pembrolizumab. So based on these data, the company has gone forward with a phase 3 trial. It's called KEYNOTE 641. It's currently enrolling, and it's looking at men who've not been on enzalutamide before, starting all the men on enzalutamide, and then randomizing them to pembrolizumab versus placebo.